Hello class, my name is Vernon Wallace and today I'm going to be talking about the impact of SARS-CoV-2, also known as COVID, on long-term care. As many of us know by now, COVID has many characteristics such as loss of taste or smell, difficulty breathing, can get headaches, can have a lot of flu-like symptoms, and it is inherently more dangerous to unhealthy or aging hosts. The nature of COVID and its severity has changed many times throughout the pandemic. This is partially due to its rapid developing nature. Once the SARS virus enters a host, it multiplies millions of times as it spreads through your body. This results in millions of mutations of the virus, which generally die off because it cannot be sustained in the host. Sometimes, though, a mutation or a variant is produced that is able to support itself and infect other hosts. This is why it is so difficult to cure the disease. Furthermore, it is extremely contagious and fast-spreading. COVID can be transmitted through airborne particles or through touching an infected surface and then touching either your eyes, your nose, or your mouth. As a result, the nature of COVID, there is a chance that a variant of high consequence is created that is able to infect a host regardless of any vaccines or previous contaminations. This variant would be extremely contagious and very difficult to treat, almost like hitting a reset on the entire pandemic. Thankfully, there have been no detections of a variant of high consequence yet. However, it is still possible for them to develop in the future. The Centers for Disease Control, or more commonly known as the CDC, has served as a guideline for many COVID regulations throughout the pandemic. In nursing homes, the CDC has recommended that unvaccinated residents be quarantined when admitted to a new facility or when in close contact with an infected person. They also recommend that asymptomatic vaccinated residents are generally not required to quarantine. However, they should still be tested if they come in contact with an infected person. Along with these recommendations and others, it is important that a strong infection prevention and control program is formed in order to keep all the residents and healthcare workers safe. An infection prevention and control program is the practice of preventing or stopping the spread of the disease. A few recommendations by the CDC have been put into place to support healthcare facilities, their workers, and their patients. A full-time trained IPC manager is recommended for facilities with over 100 residents. Healthcare personnel, or HCP, have access to the necessary supplies they need. Education for residents, HCP, and visitors so that everyone has access to the knowledge they need to stay healthy. A strong IPC would notify residents, HCP, and visitors about outbreaks. It would keep most residents and workers up to date, or all residents and workers up to date on vaccines, and physical distancing would be practiced. The use of protective equipment such as face masks and gloves would be used, and visits would be limited or canceled altogether depending on the severity of an outbreak. And lastly, quarantine or self-isolation is recommended for infected personnel. At the beginning of the pandemic, long-term care facilities were a major hotspot for the rapid spread of COVID. Due to the age demographic of long-term care facilities, seniors were particularly susceptible to the life-threatening side effects of the virus. More than 200,000 residents and staff have died due to COVID since the start of the pandemic. This unfortunate milestone was achieved through a lack of knowledge surrounding the virus. Deaths from COVID-19 in long-term care facilities account for over 23% of all COVID deaths in the U.S. due to the nature of the virus and its rapid spread of an unprepared society. Nearly half of COVID deaths were from long-term care facilities in the beginning of the pandemic. Proper regulations had not been implemented in the beginning of the pandemic, and this resulted in hundreds of thousands of preventable deaths. Many long-term care facilities were forced to take in new patients regardless of their infection status. When referring to specifically long-term care facilities in Nevada, the COVID pandemic as of March 7, 2021, has a total of 7,519 total cases, has 737 total deaths, and 217 facilities affected. As you can see in the chart below, broken down into nursing homes and assisted living facilities, there have been 2,889 nursing homes or resident cases in the nursing homes and 1,424 resident cases in assisted living facilities. Those deaths, or out of those cases, there have been 498 deaths in nursing homes and 225 deaths in assisted living facilities. For the staff, you can see that there are less or a very similar amount of staff cases in reference to the resident cases. However, there are many less staff deaths, only 11 in nursing homes and only 3 in assisted living facilities. Next, I'm going to go over an email interview I had with Jamie Cribbs, who is a registered nurse, and she has worked through many long-term care facilities from the beginning of the pandemic, even starting before the pandemic, and throughout the course of the pandemic. The first question I asked is, have you seen a shift in the public's perception of long-term care facilities during the pandemic? And what was their perception before, and how is it now? And she replied with, given the nature of COVID and its target on the elderly, a lot of residents and their families have expressed an increase in concern about their health. There has definitely been a shift in the initial concerns for families, specifically who are thinking about enrolling their patients or their parents or grandparents into a long-term care facility. Before the pandemic, many families were mainly concerned about the comfort and activities and caretaking of the enrollee. However, now their main concerns are about the sanitation and precautions that are being taken to ensure their safety. Visiting hours has also been a question that people have focused on more since the pandemic. The second question I asked is, have you noticed if any standards in the workplace have increased or decreased since the start of the pandemic? And she replied with, from my experience, there has definitely been a shift towards sanitation and prevention in our long-term care facility. Almost everything I do now in my day-to-day basis has been shifted and affected by the pandemic, whether that is wearing gloves and face coverings to reduce the spread or by enforcing COVID regulations to the residents. So much of our focus has shifted to sanitation and prevention that I feel like our relationship with the residents has shifted. Many residents don't want to follow procedures, so we have to spend more time managing our residents rather than communicating with them. The third question that I asked Jamie was, do you feel that your image as a healthcare personnel, or HCP, has changed in the eyes of the public, your patients, or by your supervisors? And she replied with, work has gotten much harder without a doubt. I think that in general, the public opinion has shifted in favor of healthcare workers such as myself. I personally always felt appreciated by my peers and by the residents, but now I feel like it's more on a global scale. The news is always talking about the brave frontline workers during the pandemic and how we have been working our hardest to work through this. So it feels good to be recognized and appreciated. Staffing shortages and new regulations has made my job feel harder, and my supervisors are under the same pressure. I think that they are also very appreciative of the work that we do. The fourth and final question that I asked Jamie is, have you noticed an increase or a decrease in resident satisfaction over the course of the pandemic? And she replied with, like I mentioned earlier, a lot of residents have expressed their dislike for the new COVID regulations, especially when it comes to masks. Even though the risk of spreading the disease is much higher, they tend to retaliate. I certainly don't speak for all the residents though, because a lot of them are very compliant and are a little scared as well. A As far as their satisfaction, it can go either way. Some residents are grateful for the extra work that we have been putting in to keep them safe through this wild time, and others would rather be left to their own devices. The continuing COVID-19 pandemic has magnified how long-term care facilities across the globe have failed to protect their residents and healthcare workers. Suggestions have been made to get rid of nursing homes and investing in home and community-based services, or HCBS. In a new commentary in Nature Aging, Professor of Healthcare Policy David C. Grabowski suggests both a redesign of current facility-based models while simultaneously investing in HCBS care models. Home and community-based services is the act of taking care of a person in need of long-term care in the comfort of their own home, rather than in a nursing home. There are many benefits to shifting towards this kind of care, but there are also some challenges to overcome. Some of the benefits include it is half the cost of residential care. Residents have familiarity of or their own space since this is staying in their own home. The family can be paid caregivers. So if a family member is willing to quit their current job and become a caregiver, they can do so. And lastly, there is counseling with bereavement. So if uh, you need counseling over mourning a lost one, you can do that in your own home. So challenges are access to providers. Currently, there aren't very many providers who provide such a service. There's also limited availability of qualified caregivers for the same reason. This is a newer type of format for long-term care, and it is still in development. There's lack of 24/7 medical professional availability since this is being done in the resident's home. There's not always a registered nurse on hand. It's difficult to get to remote areas. As you could think, if a resident is living in a remote area, it could be extremely difficult for a registered nurse or a care doctor to get to their area. And there's also potential for abuse or financial manipulation from family caregivers. And the absence of skilled nursing care from family caregivers is sometimes a consideration that needs to be taken. And lastly, here are the references that I used to conduct my research.